So my name is Diana, and I am a senior in the College of Nursing, getting my master's in nursing. I've always wanted to be a nurse as soon as I graduated from my bachelor's because I really like the interaction between a nurse and patients. Originally, I wanted to be a doctor, but then I realized that the doctors don't really have much interactions with patients, and therefore I pursued nursing. And in the future, I would like to be a midwife and be able to work with women from all over the US and help them through their labor process.
My name is Catherine, and I'm a junior in the College of Nursing here at UIC, pursuing my Bachelor's of Science in Nursing. I went into nursing because of my love of science and also a desire to interact with people on a daily basis and learn about their lives.
My name is Marlene Rios. I'm currently in my last year of the BSN program. And I have a similar story to Diana. I did want to be a doctor at first when I graduated high school. And then as I went through my prerequisites in college, I realized that I liked the way nurses were more involved and better associated with the patients than the doctors. And it was also a lot more stressful. So that's why I decided to pursue nursing, because I just want to help more people from more different cultures and be more involved with them.
So now we're going to go over what actually the role of a nurse does and what types of things that they do and different roles of nursing. There's also nursing assistants as well as LPNs and nurse practitioners.
So we will begin by sharing a slideshow with you all. So here at UIC College of Nursing, we have various different programs. We have the BSN program, so the Bachelor's of Science in Nursing, the Master of Science for non-RNs, DNP, so Doctor of Nursing, and PhD program, which is a Doctorate of Philosophy. For your Bachelor's of Science, the admission is only in the fall. You have to complete 57 credit hours of college level coursework. And it is 4 semesters long, so 2 years, and no summers are involved. So it's always going to be spring and fall semesters. After graduation, you take an exam called the NCLEX, and that will be the exam that you take to receive your licensure for registered nurse. And students in UIC interested must apply to the College of Liberal Arts and Sciences as undeclared in the application to indicate pre-nursing. The minimum criteria for admission is a 2.75 cumulative GPA, a 2.5 GPA for your natural science courses, and you must complete 3 of the 5 prerequisites by the deadline of the application. For Masters of Science, the admission is also in the fall. Graduate entry program for non-nurses who have a bachelor's degree in another field in which to become RNs is what this program is meant for. It also prepares the students to get their licensure exam similar to the BSN program, and then they go as advanced generalist nurses. So the most successful applicants often have a 2.75 GPA in the last 6 hours of their undergraduate degree. And you must complete all your prerequisites within the 7th year. Within 7 years, my apologies. For your DNP, that is the Doctorates of Nursing Practice. So this is one of the highest levels you can get. This is increasing the complexity in healthcare system, expansion of scientific growth, and growing concerns regarding quality of patient care. So the length of the program often varies. It could be anywhere between 2 to 5 years, depending on if you are a master's, a postmaster's student, or a BSN student, because you can have your BSN and go straight to your DNP, or you could be an MSN and then go into your DNP. So your PhD, which is Doctorate of Philosophy, it emphasizes research to improve nursing care, practice, and quality. So often this is collaborative relationships across various disciplines in healthcare to help improve it. The length is often 4 to 6 years, and the first part includes coursework and understanding and building knowledge to be able to do that research. The second half emphasizes building research, proposal, and conducting studies. So this shows the different types of levels of nursing that are evident to this day. So CNA is one that often is just a certificate where you do a 3 to 12 week class and you get your certified nursing assistant certification, and you do have to take an exam for that. And you usually do this during high school or at any point in your career. LPN is often a diploma of 1 year and is also can be during high school or after. An RN is when you could get it with an associate's degree, a bachelor's, or you can also get your RN licensure when you have your master's. And associates is often a 2-year program, bachelor's is 4 years, and master's is 2 years full time. And associates and bachelor's is often going to be after you graduate from high school, and your master's is often after your BSN, or not BSN, after any kind of bachelor program, or after you already are an RN. And you can be a nurse practitioner with your master's. Woo. And then for doctors, it's 2+ years, and it's often after a master's or a BSN completion. So responsibilities of a nurse is gathering information to be able to do assessments, diagnosing, identifying the patient problems and or needs, planning so you can find ways to address these problems that you gathered, and to set specific goals to be able to better the patient. Implementation is to put nursing plan into effect, and evaluation is to regularly review the patient's progress and to make adjustments to your plan when necessary to see if what you're implementing is actually working. Nursing role responsibilities, once again, overall health needs of the patient or client. It depends on what setting you're in. So you could be in a hospital, you can be in a doctor's office or clinic, you can be in a school nurse or a sport center nurse. You can also be in the Navy, in the military, and there's also many different types of specialized practices. So now we're going to go ahead and show you some of the activities that nurses have to do all the time.
Thank you. This one. Yeah. Okay, so now we're going to learn about how to take blood pressure. So here's just a little table of context about what we're learning. So what is blood pressure? So blood pressure is the measurement of the force of blood pushing against the blood vessel walls. The measurement is usually expressed in 2 numbers, the top number, which is a systolic, and the bottom number, which is a diastolic number. The top number refers to the amount of pressure in the arteries during the contraction of your heart muscle. The bottom number refers to your blood pressure when your heart muscle is beating, and this is a diastolic number. According to the American Heart Association, here are the different blood pressures and the levels. So normal blood pressure is usually a upper number of 120 or less, and a bottom number of 80 or less. Anything between 120 and 129 is elevated, and the bottom number still has to be less than 80. Hypertension, which is high blood pressure, stage 1 is between 130 and 139, and the bottom number is 80 through 89. Anything higher than 180 as the top number and anything higher than 120 over the bottom number is known as a hypertensive crisis. So this means that you need to go to the emergency room right away. So what is the physiological factors affecting blood pressure? So blood pressure is affected by peripheral vascular resistance. Resistance to the blood flow is determined by the tone of the vascular muscles and the diameter of the blood vessel. The smaller the diameter increases the blood pressure, and this is known as vasoconstriction. This is if your blood vessel is constricting, it's turning smaller and it's making less room for the blood to be able to pump, which causes more pressure. So therefore, your blood pressure is higher. Blood volume is also a big factor in affecting blood pressure. As blood volume increases, more pressure is exerted against the artery walls, therefore increasing the blood pressure. Giving IV fluids with any hypotension, so that's a patient with low blood pressure, increases their blood pressure. Someone that is losing blood will have a decrease in blood volume and an automatic drop in their blood pressure. Other factors affecting blood pressure. Age, so blood pressure varies throughout life and it also increases with our age. Our body size, as our body size increases, so does our blood pressure and emotions. With a change in our sympathetic nervous system, which is the flight or fight, emotions can cause an increase in blood pressure. Our gender can also affect our blood pressure. So males tend to have a higher blood pressure after puberty, and women tend to have higher blood pressure after menopause. Ethnicity also affects our blood pressure. African Americans tend to have a higher incidence of increased blood pressure. Our diet also affects our blood pressure. So if we eat a lot of food rich in salt and unsaturated fatty acids, this will increase our blood pressure. Smoking also increases our blood pressure, and exercise actually reduces our blood pressure. And diurnal variations, so this is how our blood pressure changes throughout the day. It usually is very low in the morning and usually rises throughout the day. Medications can also change our blood pressure. So what you need to take blood pressure is a sphygmomanometer, a stethoscope, and a pen and paper to write down your results. These are the steps in order to, a step-by-step, in order to take blood pressure. You need to make sure that your patient is sitting upright and their back is straight. There has to be a gap in between the table, the chair, and the top of the table, and their arm has to be laid out at the heart line. Here's another step where you can pause and read it to yourself, as well as this, and now we're going to demonstrate on how to take blood pressure. I'm going to stop sharing.
Hi everyone, so we're going to demonstrate how to do a two-step blood pressure measurement. So first you want to put the blood pressure cuff on the patient. There's usually two little arrows here that indicate where you should line up the blood pressure cuff. So this is her right arm, so I'm going to line up the arrows to where her brachial artery would hypothetically be, because everyone's anatomy is different. You want to make sure it's nice and snug, but also not too tight. And first, you want to determine how high you need to put the blood, you need to squeeze the blood pressure cuff. So what you do is you find your radial pulse. So it's always going to be the pulse by the thumb. Okay. So once you find the pulse, you're going to squeeze until you stop feeling the pulse. And also always use these two fingers to find a pulse. Don't use your thumb because your thumb has its own pulse. Okay. So hers stopped at about 120. So you would go 30 above that. So now I know that I have to squeeze up to 150 and I will still get an accurate blood pressure measuring. So now we turn this lever back so it's nice and tight, because if it's not screwed back in, it will not go back to zero. So you put your stethoscope right here, and you usually want to make sure you don't get it too close to the blood pressure cuff, because then you might hear the air sounds. So now you squeeze, we're going to squeeze all the way to 150, and then you want to hear the first boom you hear is going to be your top number, so your systolic. And then as you continue to loosen it, the very last sound you hear will be your bottom number. So we will now demonstrate that. So she was 110 over 76. So she has a healthy blood pressure because she is below 120 over 80. And that is how you do a two-step blood pressure.
So now we're gonna do some more reviewing for you guys to actually hear the sound.
Accurate answer. We'll use 114 over 76 as an example. All right, so now that you know the basics, let's try a few simulations. Listen closely and write down your answers. I will reveal the correct answer once the simulation ends. Here's the first one.
You can pause the video and talk about what you guys think the answer is. And the correct answer is 96 over 58. Do we know if that's a good blood pressure or a bad blood pressure? And another try?
Try another.
And did we have any guesses on what we thought that one was? So that one was 152 over 114. Is that a high blood pressure or low blood pressure? What number is too high, or if any, what number is too low?
Okay, and let's try one more.
And what do we think that blood pressure was? And that was 124/90. Is that blood pressure a good blood pressure? Is it on the brink of being bad, or is it too low? And we are all done for our demonstrations on blood pressure, and that is how you do blood pressure. And now we're going to move on to hand hygiene and how to properly wash our hands, as well as how to properly hand sanitize our hands.
In the hospital, we see these hand sanitizer pumps, and we actually use them every time we go into a patient's room and every time we go out. This is because diseases can be very contagious and can be spread from patient to patient if the disease is on my hands. So something we do is use hand sanitizer if our hands are not visibly soiled. So my hands don't have anything, any visible dirt, so I'm going to use hand sanitizer. The amount in my palm is about the size of a quarter, maybe a little bigger. Then I'm going to rub my hands together, making sure to get in between my fingers, on top of my hands, and even at the base of my wrists. You can also rub your fingernail against the palm of your hand because sometimes germs get trapped underneath your fingernails. In order for the hand sanitizer to be effective, you need to make sure it's completely dry. After that, you're all set.
All right, so now we're going to talk about hand washing when you have access to a sink. This is good anytime you can, or when your hands are visibly soiled, so you see dirt on your hands, you need to get to a sink in order to wash them. So first, I'm going to get some soap. The most important part of manual hand washing as opposed to hand sanitizer is friction. So you definitely want to rub your hands back and forth and definitely get underneath your fingernails. Then you're going to rub/rinse for 20 seconds. Okay, you might have the instinct to flick your hands, but don't do that. Keep them below your waist and head for the paper towels. Make sure you thoroughly dry your hands. And if you need to, get an extra paper towel. And then you're all set.
So that is all we have for today. We learned about what nursing is and the roles, as well as our blood pressure and how to wash our hands properly and use that hand sanitizer. Thank you so much for joining us today and learning all those 3 different things. We hope that you do consider a profession in nursing in your as a future career. And if you do have any further questions about nursing or what nurses do or how to get involved as a high school student in nursing, please don't hesitate to reach out to any of our faculty members, as well as any advisor at the College of Nursing or at UIC in general. And please attend any informational meetings if you are interested in applying to UIC's College of Nursing. Thank you.
Thank you.